Meloxicam is non-steroidal anti-inflammatory drug with anti-inflammatory and antipyretic effects. Indications: symptomatic treatment, osteoarthritis, arthrosis, degenerative disease of the joints, including those with a pain component, rheumatoid arthritis, ankylosing spondylitis. How to take, course of administration and dosage. Insight: the total daily dose should be taken at one time, with food, with water, or other liquid. Osteoarthritis: 7.5 mg per day. If necessary, the dose can be increased to 15 mg per day. Rheumatoid arthritis: 15 mg per day. Depending on the therapeutic effect, the dose can be reduced to 7.5 mg per day. Ankylosing spondylitis: 15 mg per day. Depending on the therapeutic effect, the dose can be reduced to 7.5 mg per day. In patients with an increased risk of adverse reactions, it is recommended to start treatment with a dose of 7.5 mg per day. In patients with severe renal insufficiency of hemodialysis, the dose should not exceed 7.5 mg per day. General recommendations: since the potential risk of adverse reactions depends on the dose and duration of treatment, the lowest possible dose and short duration of use should be used. The maximum recommended daily dose is 15 mg. Combined application: don't use the drug simultaneously with other NSAIDs. The total daily dose of Meloxicam, used in the form of different dosage forms, should not exceed 15 mg. Children and teenagers: the maximum dose in adolescents is 0.25 mg per kilogram. The drug is contraindicated in children under 12 years of age. Contraindications: known hypersensitivity, AG anaphylactoid reactions and serious skin reactions to Meloxicam, history of asthma, urticaria, or other allergic type reactions after taking aspirin or other NSAIDs, use during the perioperative period in the setting of coronary artery bypass graft surgery. What drugs and food should I avoid while taking Meloxicam? Avoid alcohol. Heavy drinking can increase your risk of stomach bleeding. Avoid taking aspirin while you are taking Meloxicam, unless your doctor tells you to. Ask a doctor or pharmacist before using other medicines for pain, fever, swelling, or cold flu symptoms. They may contain ingredients similar to Meloxicam, such as aspirin, ibuprofen, ketoprofen, or naproxen. Special instructions: patients suffering from disease of the gastrointestinal tract shall be monitored regularly. If ulceration of the gastrointestinal tract or gastrointestinal bleeding occurs, Meloxicam shall be discontinued. In the case of combination therapy, renal function shall be also monitored. Side effects: stomach upset, nausea, dizziness, or diarrhea may occur. If any of these effects last or get worse, tell your doctor or pharmacist promptly. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. This medication may raise your blood pressure. Check your blood pressure regularly and tell your doctor if the results are high.